Hello and welcome. Today, we'll be exploring a rare but important condition affecting the urinary system, xanthine stones. We'll delve into what they are, why they form, how they present, and how they're managed. Xanthine stones are primarily caused by a deficiency or malfunction of the enzyme xanthine oxidase. This enzyme plays a crucial role in the breakdown of purines, which are natural substances found in your body and in certain foods. When xanthine oxidase isn't working properly, xanthine, an intermediate product of purine metabolism, accumulates in the body. This excess xanthine is then filtered by the kidneys and can crystallize in the urine, forming xanthine stones. This deficiency can be inherited genetically, known as hereditary xanthinuria. Additionally, some medications, like allopurinol, which is used to treat gout, can also inhibit xanthine oxidase and, in rare cases, lead to xanthine stone formation, especially if the dosage isn't carefully managed or if the patient has underlying kidney problems. Let's understand the pathophysiology. So normally, purines from dietary sources and the body's own cell turnover are broken down into hypoxanthine. The enzyme xanthine oxidase then converts hypoxanthine into xanthin and further converts xanthin into uric acid. Uric acid is usually excreted by the kidneys. However, in xanthinuria, the deficiency or inhibition of xanthine oxidase leads to a buildup of xanthin. Xanthine is less soluble than uric acid in urine, meaning it's more likely to precipitate out of solution and form crystals. These crystals aggregate and grow over time, resulting in the formation of xanthine stones within the kidneys or urinary tract. These stones can then obstruct the flow of urine, causing pain, inflammation, and potentially leading to kidney damage if left untreated. Xanthine stones are relatively rare, accounting for less than 1% of all kidney stones. Hereditary xanthinuria, the primary cause, is an autosomal recessive genetic disorder, meaning that individuals must inherit 2 copies of the mutated gene, one from each parent, to develop the condition. Due to its rarity, precise epidemiological data is limited, and the true prevalence may be underestimated. Individuals on allopurinol therapy should be monitored for the risk, but the development of xanthine stones is uncommon in this population, usually occurring only with high doses and pre-existing renal issues. The signs and symptoms of xanthine stones are similar to those of other types of kidney stones. Common symptoms include flank pain, which is a sharp, severe pain in the side and back, often radiating towards the groin. This pain, often referred to as renal colic, is caused by the stone obstructing the flow of urine. Other symptoms may include hematuria, which is blood in the urine, nausea and vomiting due to the severe pain, dysuria, which is painful urination, and frequent urination. In some cases, if a stone completely blocks the urinary tract, it can lead to a kidney infection or even kidney failure, presenting with fever, chills, and severe abdominal pain. Diagnosing xanthine stones can be challenging due to their rarity. A detailed medical history, including information about medications like allopurinol and family history of kidney stones or metabolic disorders, is crucial. Urinalysis may reveal the presence of xanthine crystals, but this is not always definitive. Imaging studies, such as an X-ray ultrasound or CT scan of the abdomen and pelvis, are essential to visualize the stones. Xanthine stones are often radiolucent, meaning they are not visible on standard X-rays, making CT scans the preferred imaging modality. Chemical analysis of the stone after it has been passed or removed is the gold standard for confirming the diagnosis. This analysis determines the composition of the stone and confirms that it is indeed composed of xanthine. There are no specific classifications or subtypes of xanthine stones beyond differentiating between those caused by hereditary xanthinuria and those induced by medications like allopurinol. The underlying mechanism of xanthine accumulation, whether genetic or drug-induced, is the key factor. The treatment and management of xanthine stones focuses on reducing xanthine production and promoting its excretion. Increased fluid intake is crucial to dilute the urine and help flush out the xanthine. Dietary modifications, such as limiting purine, rich foods like organ meats, seafood, and red meat can help reduce xanthine production. In some cases, medications like allopurinol may be adjusted or discontinued, especially if it is the causative factor. If the stones are small, they may pass spontaneously with conservative management. However, larger stones that cause significant obstruction or pain may require intervention. Procedures such as extracorporeal shockwave lithotripsy (ESDL) retroscopy or percutaneous nephrolithotomy (PCNL) may be necessary to break up or remove the stones. Urine alkalinization with potassium citrate can also be used to increase xanthine solubility, preventing future stone formation. Preventing xanthine stones primarily involves addressing the underlying cause. For individuals with hereditary xanthinuria, lifelong management is essential, including maintaining a high fluid intake, following a low purine diet, and potentially using medications like allopurinol if paradoxical stone formation is not a concern. Regular monitoring of urine xanthine levels can help guide treatment and prevent stone recurrence. For those on allopurinol, careful dose adjustment and monitoring of kidney function are crucial to minimize the risk of xanthine stone formation. Periodic urine analysis and imaging studies may be recommended to detect any early signs of stone development. The prognosis for individuals with xanthine stones depends on the underlying cause and the effectiveness of treatment. With appropriate management, including dietary modifications, increased fluid intake, and potential medication adjustments, the recurrence rate can be minimized. However, individuals with hereditary xanthinuria require lifelong monitoring and management. Recent research has focused on improving diagnostic techniques for identifying xanthine stones early and developing more targeted therapies to reduce xanthine production. Further studies are needed to fully understand the long-term effects of xanthine stones on kidney function and to develop more effective prevention strategies. Genetic counseling is important for families with a history of hereditary xanthinuria to understand the risk of passing on the condition to their children. Thank you for joining me on this exploration of xanthine stones.